Every afternoon around 3, something arrives that you have learned to live with and have stopped describing to anyone. The words sit on the tip of your tongue and refuse to move. The space behind your eyes feels pressurized, as if a slow tide is pushing outward from somewhere deeper than the eyes themselves. You read the same paragraph a second time, then a third, and the sentences slide off the surface of your attention like water off oiled glass. You blink, you rub your temples, you reach for coffee that no longer works. You stare at a screen and feel the cursor blinking back at you like an accusation. By evening, a hot shower lifts it slightly, a long walk lifts it more, and then, by the next afternoon, it returns. Studies estimate that a striking percentage of adults now report this exact pattern of persistent cognitive fog, and clinical literature documents that patients often spend years cycling through specialists before the actual mechanism is even named. The brain flushes liters of waste-laden cerebrospinal fluid through its tissues every night, and when that nightly flush fails, the residue is what you feel at 3 in the afternoon. That fog has a name, a mechanism, a drainage pathway. Your neurologist has never once tested for it. The diagnostic system buried this because there is no billable code, no scan, no pill, only a system that drains for free while you sleep. By the end of this video, you will know exactly why this was never explained to you, and the specific steps you can take starting tonight. Subscribe so you never miss what the medical establishment hopes you never ask about. To understand how this was buried, you have to go back to a laboratory at the University of Rochester in 2012, where 2 researchers named Maiken Nedergaard and Jeffrey Iliff watched something move inside a living brain that medical textbooks had insisted for over a century could not exist. Using 2-photon imaging on living mice, they tracked cerebrospinal fluid as it pushed itself through narrow channels surrounding the brain's arteries, swept through the surrounding tissue, and carried away metabolic waste, including the protein fragments associated with cognitive decline. They called it the lymphatic system. The brain had drainage. It had always had drainage. The anatomical hints had been recorded as far back as Paolo Mascagni's Lymphatic Atlas in 1787, and the great Italian anatomist had drawn vessels along the base of the skull that his contemporaries dismissed as artistic exaggeration. He was not exaggerating. He was simply 2 centuries too early. For over 200 years, the brain was taught as a sealed organ, immune to the drainage rules of the rest of the body, walled off behind the blood-brain barrier as if waste simply evaporated. The brain was never sealed. It drained. We just could not see it. And here is the part that changes everything you have been told about cognition. The drainage does not run continuously. It runs almost exclusively during deep sleep, when channels called aquaporin 4 open along the brain's blood vessels, and the flush rate accelerates roughly 10-fold. A 2013 study by Z and colleagues published in the journal Science documented that sleep itself is the mechanism by which the brain clears its own metabolic debris. The waste then drains downward through tiny vessels at the cribriform plate behind the nose, through the dural sinuses, into the deep cervical lymph nodes at the sides of your neck, the same nodes a doctor sometimes palpates during a flu visit and never connects to your fog. A system that costs nothing existed long before the industry that replaced it. This is the origin revelation. The biology is not new, not contested, not exotic. It is published. It is anatomically documented. It is reproducible. And it predates by decades the entire pharmaceutical category built around treating the symptoms it produces when it fails. Postmortem research has now linked impaired meningeal lymphatic flow to early cognitive decline. Imaging studies have correlated reduced lymphatic clearance with the heaviness behind the eyes that patients report on poor sleep mornings. A heaviness that is not metaphor but measurable, backed-up interstitial fluid pressing outward against the connective tissue of the orbit. Researchers using advanced contrast MRI protocols have actually watched the flush slow in patients with chronic sleep disruption. They have measured it in real time. The proof was there. The diagnostic code was not. To understand the second half of the picture, you have to look below the neck. The lymphatic system as a whole moves several liters of fluid out of your tissues every single day. It runs in vessels the width of a human hair. It has no central pump. It relies on muscle movement, breathing, and the rhythmic compression of walking to push fluid upward against gravity through one-way valves that snap shut behind every wave. The deep cervical chain in your neck is the bottleneck through which the brain's drainage must pass before rejoining the bloodstream at the junction near the collarbone. Stagnation in the neck is stagnation in the brain. This is dual system failure, and it is invisible on every standard panel. In 22 years of treating patients whose lymphatic systems had been failing silently for a decade, I have never once seen a lymphatic panel ordered by a primary care physician. There is no such panel to order. A woman I will call Margaret arrived in my office at 47 after seeing 11 different doctors over 8 years. She had been told she was depressed. She had been told it was perimenopause. She had been told her blood work was fine. She had been prescribed 3 different stimulants, 2 antidepressants, and a sleep medication that fragmented the very deep sleep her brain needed to drain itself. Her records showed no investigation of lymphatic function. There was no billing code that would have justified one. She told me she had started writing notes to herself before meetings because she could no longer trust her own recall of the previous afternoon. Her husband had stopped asking her about her day. Her teenage son had asked her gently if she was angry with him because she kept forgetting the things he told her. She thought she was disappearing. This is where the story splits, and where you need to listen carefully, because what helps one person actively damages another. Clinical observation across patient populations indicates the fog tends to fall into 3 distinct types. Type 1 is cervical stagnation fog, worst on waking, paired with neck stiffness and puffy under eyes that take an hour to resolve. The face looks slept on long after sleep has ended. The differentiator is critical. Stimulants make it worse because they constrict the very vessels that need to open for drainage. Type 2 is lymphatic sleep failure fog, clear in the morning, then a crushing afternoon crash, vivid dreams that do not feel restorative, and a sleeper who wakes sweating in the middle of the night. The mind feels rinsed but never clean. The differentiator is brutal. Sleep aids that suppress deep sleep deepen the dysfunction, because deep sleep is the only window when the flush runs at full speed. Type 3 is inflammatory load fog, fog that worsens after meals, after illness, paired with gut symptoms and migrating joint aches. The body feels heavier on some days than others for no reason the patient can name. The differentiator is the one most people get wrong. Aggressive detoxes flood an already clogged drainage system, dumping waste into vessels that cannot move it. Identified your type? Hold it in mind. Because what I am about to tell you only applies if you know which category you are in, and what helps one type actively worsens another. Now here is the number that changes everything. The American Association of Medical Colleges has documented that the average medical school dedicates only a small handful of curriculum hours to the lymphatic system across 4 full years of training, 4 years of medicine, a few hours on the system that moves more fluid through your body every day than your bloodstream does. Think about what that means. The doctor sitting across from you in the fluorescent light of an exam room studied the heart for weeks, the kidneys for weeks, the endocrine system for weeks, and the lymphatic system for an afternoon. They did not choose this. The curriculum chose it for them. This is not malice. This is structure. And here is where the real suppression begins, because it is not a conspiracy. It is something far more durable than that. It is a structural outcome. The diagnostic code system, the CPT reimbursement schedule, the insurance underwriting model, all of these are built to reimburse the things that can be billed in a 15-minute appointment. A scan can be billed, a prescription can be billed, a diuretic can be billed, manual lymphatic drainage, sleep position correction, cervical decongestion, hydration timing. These reimburse near zero. They take time. They have no brand name. They cannot be patented. They cannot be advertised. They cannot be sold by sales representatives in suits with glossy folders. They cannot be packaged into a sample box left on a clinic counter. The lymphatic system was not disproven by science. It was excluded by the economics of symptom-targeting medicine. Treating the root costs almost nothing. Treating the symptom generates billions. The GP who never investigates your lymphatic drainage is not your enemy. They were trained in a system that gave them no tool to do so, no test to order, and no time in a 15-minute appointment to acquire one. They are running on the same exhausted fumes as you are, inside a system that rewards throughput over investigation. They went into medicine to help people. The system handed them a stopwatch instead. This is the part the diagnostic industry cannot explain away. In 2015, a research team led by Antoine Louveau, working at the University of Virginia, published a paper in Nature documenting functional lymphatic vessels in the dural lining of the brain, vessels that medical textbooks had stated for over a century did not exist. The brain had a lymphatic system. It had always had one. The textbooks were wrong. The textbooks are still being printed. The new edition does not always correct the old. My name is Dr. James Whitfield. I was the head of lymphatic and vascular medicine for over 2 decades. I am telling you this now because what I watched happen to my patients for 22 years should not happen to you. The research is not hidden in some foreign laboratory. It is sitting in the NIH database. It has been cited in peer-reviewed American journals.
They went into medicine to help people. The system handed them a stopwatch instead. This is the part the diagnostic industry cannot explain away. In 2015, a research team led by Antoine Louveau, working at the University of Virginia, published a paper in Nature documenting functional lymphatic vessels in the dural lining of the brain. Vessels that medical textbooks had stated for over a century did not exist. The brain had a lymphatic system. It had always had one. The textbooks were wrong. The textbooks are still being printed. The new edition does not always correct the old. My name is Dr. James Whitfield. I was the head of lymphatic and vascular medicine for over 2 decades. I am telling you this now because what I watched happen to my patients for 22 years should not happen to you. The research is not hidden in some foreign laboratory. It is sitting in the NIH database. It has been cited in peer-reviewed American journals. It has been published by Harvard Medical School research groups, by Mayo Clinic neuroscience teams, by Johns Hopkins investigators studying cerebrospinal flow on advanced MRI protocols. And it has still never been translated into a conversation your doctor has had with you. Instead, the fog gets a different label: anxiety, depression, perimenopause, stress, aging. The patient is handed a prescription that suppresses the very deep sleep their brain needs to drain itself, and the cycle deepens. The afternoon crash gets worse. The morning heaviness gets longer. The notes to self get more frequent. The world shrinks. Now look at the contrast. In Germany, the Foldi Clinic has been running hospital-based lymphology programs for decades with monitored patient cohorts, peer-reviewed outcome data, and documented symptom reduction across thousands of cases. The clinic does not treat lymphatic dysfunction as alternative medicine. It treats it as medicine. In Scandinavia, sleep position protocols and cervical drainage techniques are deployed inside the standard healthcare system. In the Netherlands and Austria, manual drainage therapy is reimbursed as routine medical care, written into insurance policies the way physical therapy is written into yours. The proof is published. In another language, in another country, American patients are still being told their fog is normal aging. A retired school teacher who had been dismissed by 11 different doctors came to me convinced she was developing early dementia. She had stopped driving on highways. She had stopped meeting friends for lunch because she was afraid she would forget their names mid-sentence. She had begun avoiding phone calls because the silences while she searched for words felt unbearable. Her imaging showed no neurodegeneration. Her blood work was, again, fine. What we found was a pattern of nightly drainage failure, sleeping flat on her back, eating a heavy meal an hour before bed, alcohol 3 nights a week, and a dehydration pattern that left her interstitial fluid thick and slow. None of it was random. All of it was correctable. Within 12 weeks of restoring overnight drainage conditions, the morning heaviness behind her eyes was gone. Her words returned. She read a novel for the first time in 4 years. She drove herself to the appointment. She called her sister, unprompted, and talked for an hour without losing the thread once. So here is what biology cannot erase. A 2015 study by Lee and colleagues, published in the Journal of Neuroscience, documented that lymphatic clearance is measurably more efficient when the body sleeps on its side, particularly the right side, compared to sleeping on the back or stomach. The mechanism is gravity dependent. The position matters. Research shows that lymphatic clearance still increases dramatically during deep sleep in every healthy human alive. The biology has not changed. What has changed is what you are told about it. So if you recognize yourself in type 1, the cervical stagnation pattern, what clinical evidence documents is this: side sleeping rather than back sleeping, an elevated head position by a slight angle, the kind a folded pillow naturally creates. Gentle cervical drainage strokes downward along the sides of the neck toward the collarbone in the evening, the way a lymphedema therapist would teach in a clinical setting. Avoiding stimulants after noon because the vessels that need to open for drainage stay constricted under their influence. Slow, deep breathing through the nose for several minutes before bed because the diaphragm is one of the body's primary lymphatic pumps, and a shallow breather drains poorly. A short walk after dinner, even 10 minutes, because muscle compression activates the lymphatic chain along the legs and abdomen. If you recognize yourself in type 2, the sleep failure pattern, what 22 years of treating patients has shown me is this. Stop eating 3 hours before sleep because digestion competes with drainage for the body's nighttime resources. Eliminate alcohol within that window because alcohol suppresses the deep sleep stage when the flush runs at full speed. Hydrate earlier in the day rather than late because midnight bathroom trips fragment the very window you need to protect. Keep the bedroom cool because the deeper stages of sleep require a slight drop in core temperature. Dim the lights an hour before bed because melatonin is the chemical signal that opens the drainage window. Protect the deep sleep window above all else because everything else depends on it. If you recognize yourself in type 3, the inflammatory pattern, the published literature confirms this. Do not flood a clogged system with aggressive detoxes. Restore movement first. Walk in the morning to activate lymphatic flow through muscle compression because every step is a pump. Breathe deeply because the diaphragm moves more lymph in 20 minutes of slow breathing than an hour of stillness. Eat slowly. Sit upright after meals rather than slumping. Give the gut lymphatic interface time to clear before lying down. And only then, once the drainage is moving again, address the inflammatory load. None of this is a cure. None of this is a promise. This is what the documented mechanism of the system suggests, and what monitored patient cohorts in European clinical settings have shown over years of follow-up. The body does not forget. The lymphatic system has not changed. The vessels are still there, the width of a human hair, running along your arteries, draining through the cribriform plate, filtering through the deep cervical chain at the sides of your neck. They have been there since the day you were born. They will be there tonight. They will be there when this video ends and you stand up and walk into the rest of your evening. They will be there long after the diagnostic code that ignored them has been quietly retired and replaced with another. The system is not waiting for permission. It is waiting for conditions. It does not need a prescription. It does not need a referral. It does not need an appointment 6 weeks from Tuesday. It needs a body lying on its side, breathing slowly in a cool, dark room, undisturbed long enough for the flush to begin. Tonight, when you turn onto your side and your breathing slows and the deep sleep window finally opens, the first wave of cerebrospinal fluid will move through the perivascular channels of your brain, sweeping the day's metabolic residue toward the nodes in your neck, then downward into the bloodstream, then out. The flush will run, the drainage will work, the pressure behind your eyes will ease. The fog that has owned your afternoons will begin to loosen its grip, one night at a time, as the system you were never told about does the work it was always designed to do. The biology never changed. Only what you were told about it did. This content is for educational purposes only and does not constitute medical advice. Always consult your physician before making changes to your health routine.